Hi, I'm Colin Hung with Healthcare IT Today, where we explore the latest trends and interesting stories in health IT. On today's program, we're going to learn a bit about a unique organization who's doing some phenomenal work on behalf of all digital health vendors here in the US. And joining me today is Brian Scarpelli, Executive Director of the Connected Health Initiative. Brian, welcome to the program.
Thank you for having me.
I am so curious. I mean, after I learned what you guys do, I thought we definitely got to get you on air here.
Great.
But can you give us a little bit of background on what the Connected Health Initiative really is?
Absolutely. It's a pro-digital health policy advocacy organization, nonprofit that is based in Washington, D.C. The goal, in a nutshell, of the organization is to identify policy goals that we can find thread of agreement across vendors, developers, physicians themselves, other clinicians, providers, insurers, you name it, patient groups. And then that drives the policy goals that we're asking for either at the congressional level, the federal agency level, increasingly at the state level.
So who are members of the CHI? Like who is joining the initiative, in other words?
It is a very broad, diverse range of stakeholder groups or community representatives, I would say, for the group. But we publicly listed all. It's like 30 some organizations right now are on a steering committee that we have that really is captaining our ship, keeping us on the right track, helping us identify the priorities that we have and things like that. And there's a wider community that we also interact with that is it's several thousand people, hundreds of companies.
And are these all health IT companies, or what kinds of organizations?
Anyone who has an interest or is impacted by digital health policy, pretty much, is you'll find them in some shape or form in this group. So, as some examples, there are some leaders in some new areas in digital health as far as industry and developing the products. ResMed is, for example, a member. Roche, some larger companies like that, a handful of startups, some of which are here as well. It's really great to see.
And what kind of policy decisions or what kind of policy are you trying to influence with CHI?
It falls into a number of buckets, and to rattle them off, I guess I can say. Reimbursement and payment is a massive issue, right? And that's a lot of that is focused on influencing Medicare payment.
I gotcha.
One, because of the sheer size of that program and the impact on so many beneficiaries, but also because they have an influence on broader payment policies, even from private.
So are you advocating for better workflows, improved efficiency, getting rid of some red tape, for example?
Yeah, a mixture of reactive and proactive stuff, but reimbursement, privacy and security issues that will never go away. The role of the Food and Drug Administration as they're addressing emerging technologies, health data flows, even interoperability and information blocking and other subtopics there, and some proactive stuff in artificial intelligence and value-based care.
Wow, of that. That's quite a lot of topics.
It is. It's a lot, yeah. And it didn't start that way. We've just been picking up more and more consensus across all of these different groups that we're trying to find that thread of agreement across, which is encouraging and very interesting to observe after this effort is about 7 years old, right? To see how it's evolved. These new issues have come up. So there are some instances where we're identifying regulatory barriers. Sometimes the barriers are even in a federal statute.
Right.
Some of these barriers are 25 plus years old, right? And they
born at a time when digital health wasn't quite as advanced as it is now.
Well-intended, checks put in place usually to avoid overuse and fraud, and who could predict internet connectivity and the state of it today and the capabilities that are being developed and things like that. But, long story short is you have some of these legacy restrictions that are holding back deployments with very little public benefit, So we're always aggregating and identifying those barriers and then trying to find ways to modify either the law or regulation to get them out of the way while still enabling the responsible use of the products and the flexibility to use them by the the clinician at the end of the value chain. That's kind of like the reactive, where it's like this is a regulatory pain, we're addressing that. that would definitely do that across those areas. But in some of the areas, you can imagine like artificial intelligence, where we're just being extremely proactive, and we're trying to help shape what the new governance is going to be, what the role of a federal agency that's trying to protect patients from a number of different angles should be, and just help them understand the technology, understand how a scaled approach to risk management is really, really critical, and then a one-size-fits-all that's going to stop some pro-patient deployment that otherwise would be out there, be rolling out there. So that's kind of a different role in a sense, rather than collecting pain points, essentially. We're identifying new opportunities, and in a number of it's pretty fun. In a number of instances, we've been able to turn those, kind of proactive identifying opportunities into real policy changes that have taken like incremental steps to support, the use of
digital health,
digital health tools. As an example, today the Medicare system provides unbundled or standalone reimbursement for using a predictive algorithm to support making a clinical decision. It's only for one use case right now, diabetic retinopathy.
Right.
But I know of no other health system in the world that provides any sort of reimbursement like that. And that's pretty, you commend the agency, right? It's pretty amazing, but that's all based on several years of work that we've had underway as an organization, as part of the coding process, and through pulling together consensus across all the companies and patient groups, et cetera, that are impacted, to find that thread of agreement, and it translated into a real life policy change that has enabled stuff.
Yeah.
And so now we're at a point where we're talking about what could be next, because certainly when there's a new service like that that's enabled in a system like Medicare, they're looking very closely as whether the sky is going to fall. Is there going to be rampant overuse or something like that? And that isn't the case, because there's adequate safeguards in place today. There's good reliance on the fact that the Food and Drug Administration, for example, is vetting and clearing the tools that would be used for reimbursement. And there's a whole bunch of, there's a growing evidence base, which I know some will talk about in a second, demonstrating improved outcomes, improved patient engagement in their care, cost savings systemically, and an improved experience for the workforce, which is also that's one of those understated benefits, I think.
So let's talk about that.
Sure.
You have something called the Digital Health Evidence Resource Database.
Yeah.
What is that? You just kind of mentioned it a little bit there.
Yeah. So that's a really important effort for us. I'm really excited about it. And the point, I put it this way: the problem statement is that across different policymaking bodies and venues, whether it's a federal agency or a staff person on Capitol Hill, or someone setting policy for an organization, a hospital or hospital system, or private payers, there's not there is no go-to resource to get into an idea of efficacy for some of these new and emerging tools.
Okay.
Now the tools are new. There's not 20 years of clinical evidence that's yet been developed for them, but our goal is to inform the public debate, basically, by aggregating and vetting for quality clinical data and studies that will show the efficacy of new emerging technology, digital health tools. An interesting, not a tangent, but an interesting side story about that led to the creation of it as it is now and how we have it, is that there's, to make it a little bit of background, is there's been reimbursement in place for asynchronous remote monitoring in Medicare now in some shape or form for about 5-6 years.
Yep.
And at the agency level, there's a very critical eye, at the federal agency level and amongst providers, et cetera, about what is the state of the evidence and does it work? And it kind of came to a point with a meeting that was convened by the Medicare Administrative Centers, the MACs as they call them, which are the regional entities that process Medicare claims and have some flexibility about medical necessity and things like that. And the whole premise of this MAC meeting, this multi-jurisdictional MAC meeting, was to assess the state of the evidence base. And I think a lot of people looked around, were saying,
and didn't have anything, and that's why you created the resource.
So we wanted to, our goal long-term for this evidence base is to have it be about more than just remote monitoring, but to be responsive to the scope of this MAC meeting. And we had a clinician engaged as a subject matter expert and things like that too, but we've basically created a beta of the resource, and it's scoped to speak to efficacy of remote physiologic and therapeutic monitoring.
So is this for companies who may have a remote patient, any sort of device, any sort of digital health product? This is an opportunity for them to provide into this database.
Absolutely.
The clinical evidence of their system working.
Right.
And then you will use that to advocate and use when talking to the policymakers.
Right.
Is that kind of how it works?
Exactly. We're in the midst of kicking off essentially a campaign around this evidence base as we grow the evidence base and include more modalities than just asynchronous remote monitoring. There's some new data that is relevant for various artificial intelligence use cases, for example, that's coming out all the time.
And so how can companies get involved and contribute to the database?
Just reach out and let us know. There's a number of levels that people can get involved at. We are looking for people to help us aggregate this information and to work with our clinician to vet the information. I should mention too that we're basing the standard for admittance for acceptance into the resource right now on the standard that would be used in making a coverage determination by Medicare. So it's a relatively high standard. We've done a lot of vetting on it. But there's, people can search on PubMed and try and use keywords and things like that, which is, without some kind of a go-to resource to speak to the evidence. I think a decision maker, a policy maker is, what we're finding is that they're running across things that are more marketing material, and there's nothing wrong with marketing material, but they're looking for evidence and they can't find it in that one resource. So it should inform policy decisions about changes in coverage in Medicare, outside of Medicare and private payer systems. We're excited about how it's taking shape right now. And then there's a big campaign that we have that we're about to launch, which is using that evidence as kind of a base for further requests, and changes and tweaks to coverage, you name it.
Brian, you've shared a lot of great information. Where can people go to find more information about CHI?
We have. I would go to our website.
Perfect.
connectedhi.org.
Perfect.
And you'll pretty prominent. You should find a link to contact us. You'll find a number of resources that we have. If actually, there's one thing I could mention too that people may find as a helpful resource on the site that is related, but a separate resource too is one just as for the public's benefit, basically. But we've been collecting and organizing all of the public health emergency related flexibilities and waivers and allowances that relate or impact to digital health, and have aggregated them in one document. That's yet I raise it because hopefully that's just a resource, and you'll find things like that on our site. But it's also, with the public health emergency expiring on May 11th, very soon, right? There's probably going to be some pretty condensed policy making decisions about whether flexibility should continue and who should affect them, whether Congress has to act or whether the agency has to act. And this kind of evidence, the evidence aggregation, the resource that we're creating, I'm hopeful will inform those kind of policy decisions.
Excellent. Well, thanks, Brian, for being on the program today. Really appreciate it.
Really appreciate it.
Hey, if you enjoyed this interview as much as I did, why don't you head over to healthcareittoday.com, where you can find similar content to what you've heard here. I'm Colin Hung for Healthcare IT Today. Thanks for being here, and we'll see you on the next one.